Welcome to today's webinar on the air quality module produced by the Minnesota Department of Health. I'm Michaela Rush, a health educator and communications specialist with the Climate and Health Program at the Minnesota Department of Health. The Minnesota Climate and Health Program is part of a nationwide effort to anticipate, prepare for, and respond to the health impacts of climate change. The program follows 5 overarching goals that guide its work: educate and increase awareness of the health impacts of climate change, research and improve data for research to ensure that our work is based on the best science available, design and evaluate adaptation interventions, develop tools and products for public health practitioners and others to use to prepare for climate change, and provide technical assistance to communities for mapping vulnerable populations and planning for climate changes. This training module is one of 7 training modules that address the health effects of climate changes in Minnesota. The other training modules cover the topics of Climate and Health 101, Extreme Heat Events, Agriculture and Food Security, Water Quality and Quantity, Well-Being, and Vector-Borne Disease. These modules have been designed for public health professionals as well as others concerned about climate change to provide a basic level of information about the observed climate changes in Minnesota and their health impacts. Each module is a set of slides scripted with slide notes so you can present them to your own audiences. These training modules are funded in part by a grant to the Centers for Disease Control and Prevention. Following each webinar, we will post the training module on the Minnesota Department of Health website so anyone can access it for future use. Today's webinar will be interactive. We will be asking 4 polling questions throughout the session that you can respond to using the polling bar that will appear on the right side of your screen. If you have any questions throughout the session, please submit them using the chat function located in the drop-down on the top of your screen. We will be saving 15 minutes to answer questions at the end. I would now like to introduce our presenter for today's webinar, Nissa Tupper. Nissa is a Climate and Health Program Planner at the Minnesota Department of Health, where she works across agencies and disciplines to develop and implement climate and health adaptation strategies. She's also part of the Minnesota Joint Air and Health Initiative, a collaboration between the Minnesota Department of Health and the Minnesota Pollution Control Agency. This interagency effort focuses on improving the understanding between air quality and health and engaging communities to reduce health impacts attributable to air pollution. Nissa earned a master's in landscape architecture from the University of Minnesota and is also an experienced public relations professional. Welcome, Nissa.
Thank you, Michaela, and thank you everyone on the call for listening in today. The module today will provide an introduction to air quality and public health, address the observed climate changes in Minnesota, and explain how climate change will affect 3 major air pollutants that are linked to negative health impacts: particulate matter, ozone, and allergens. The module will then wrap up with some general strategies on how public health agencies and local governments can mitigate or adapt to the changes in climate and air quality, and how individuals can also take actions to address climate change. So to begin with, it's important to ground ourselves in the understanding that clean air is essential for overall human health and well-being, thriving ecosystems, and a sustainable economy. Overall, air quality in Minnesota has improved over the past 20 years. This is due in part to controls put in place under the Clean Air Act. Annual air pollution emissions in Minnesota have decreased by nearly 40% since 1990. The greatest emission reductions have been achieved by power plants, which are often considered permitted sources, with emissions falling by nearly 70% between 1990 and 2013.
We will now be having our first polling question. Air pollutants come from various sources, including permitted sources, such as power plants and factories, as well as smaller, more widespread sources, such as on-road and off-road vehicles, work equipment, and residential sources. What percentage of emissions come from smaller, more widespread sources in Minnesota? 11%, 35%, or 67%? You will now have 30 seconds to submit your response. Okay, just a couple more seconds on there and we're going to close the poll, and then we will be showing the results. Thank you for answering. 67% of emissions come from smaller, more widespread sources. Let's learn more.
There are four main categories of air pollutants in Minnesota. They include on-road vehicles, off-road vehicles and equipment, neighborhood sources, and permitted sources. As you just learned in the polling question, small and widespread sources are the largest portion of overall air pollution emissions in Minnesota. These sources include on-road vehicles like cars, trucks, and buses, off-road vehicles like construction and agricultural equipment, and neighborhood sources like small businesses, heating, and wood smoke. While air quality in Minnesota currently meets federal standards, it's important to recognize that even low and moderate levels of air pollution can contribute to serious illnesses and early death. The risk to any one individual from air pollution is determined in part on factors related to two things: exposure and sensitivity. People who can suffer from long-term or chronic exposures to air pollution include individuals in outdoor occupations, such as truck drivers, construction workers, gas station attendants, and others who are exposed to vehicle exhaust emissions for extended periods of time, or people who live adjacent to high-traffic corridors. People who can suffer from short-term or acute exposures to air pollution may also include workers in certain occupations, as well as athletes who breathe faster and take in more air, and therefore more pollutants, during practice or competition, which can pose a health risk on high pollution days. Examples of people with certain sensitivities to air pollution include people with existing health conditions such as asthma, diabetes, chronic obstructive pulmonary disease, also referenced as COPD, allergies, or cardiovascular disease. There is evidence to suggest that these conditions are significantly aggravated by exposure to air contaminants. Young people and children over the age of 65 can also be more sensitive to unhealthy air. So with that introduction to air quality and public health, we'll move on to explore the climate changes in Minnesota. Although related, the terms weather and climate are definitely different. Weather generally refers to conditions of the atmosphere over a short period of time, like days or weeks, while climate refers to conditions of the atmosphere over long periods of time, like 20 to 30 years. So climate change refers to any significant change in the measures of climate lasting for an extended period of several decades. Two other terms that are important to clarify are climate adaptation and climate mitigation. Actions to prevent the negative health effects of climate change can be described as one or the other. For climate adaptation, this means to anticipate or prepare for the effects of climate change in order to reduce the associated health burdens. Climate mitigation, on the other hand, refers to efforts that slow, stabilize, or reverse climate change by reducing greenhouse gas emissions. Here at the Minnesota Department of Health, we're dedicated to understanding the links between climate changes and negative health impacts, and identifying strategies for addressing these health impacts in our communities. Most climate scientists attribute our changing climate to the burning of fossil fuels, like coal and oil, to produce energy for everyday use. This burning adds heat-trapping gases into the air, like carbon dioxide, methane, and nitrous oxide. These heat-trapping gases are commonly called greenhouse gases. So as you can see on this graphic, the rise in greenhouse gases is leading to increases in our temperature and changes in precipitation. These changes are then disrupting our air quality, weather patterns, water quality and quantity, and ecosystems, which in turn are leading to more air pollution, extreme heat, floods and drought, and ecosystem threats. Many of these changes have impacts on the health of people, and these impacts will likely increase. One of the main effects of Minnesota's changing climate is that temperatures are rising. Minnesota has gotten noticeably warmer, especially over the last few decades. This slide shows a shift in the rate of change of Minnesota's annual average temperatures. The time frame is from 1895 to 2016, which is approximately the last 120 years. On the left side, you can see Minnesota's temperatures for roughly the first 60 years, from 1895 to 1959, where temperatures increased by about 0.2 degrees Fahrenheit per decade. The graph on the right side shows roughly the next 60 years, from 1960 to 2016, where Minnesota's average temperature has accelerated to a rate of over 0.5 degrees Fahrenheit per decade. This would amount to an increase of 5 degrees Fahrenheit that we would experience by the end of this century, a significant accelerated rate. Now focus your attention on the red dots. These represent the 10 warmest years in Minnesota. As you can see, 9 of the 10 warmest years in the state recorded since 1895 have occurred in just the last 3 decades. Within this overall annual warming pattern, there have been 3 significant observations here in Minnesota. First, winter temperatures are rising twice as fast as the annual average temperatures. We're now experiencing more warmer winter temps, less snow and more winter rain, and changes in the amount of ice. Secondly, minimum temperatures, which are the overnight lows, have been rising faster than maximum temperatures, which are the daytime highs. In just the last 30 years, average annual overnight lows have been rising at a rate of 6 degrees Fahrenheit per 100-year period. And lastly, the northern part of the state is warming faster than the southern part of the state. Over the last 50 years, there has been a distinct spread of warmer overnight lows in the northern part of Minnesota. This is consistent with patterns seen across the northern hemisphere, where climate changes are occurring more rapidly at these higher latitudes. These rising temperatures are already causing substantial shifts in the environment. Maps of the plant hardiness zones from the U.S. Department of Agriculture show what types of plants will survive well and where. Zones are based on average annual minimum winter temperature over a 30-year period, and each zone represents a 10 degree Fahrenheit increment of minimum temperatures. The maps you see on this slide compare 2 points in recent times. The map on the left is from 1990, and the map on the right is from 2015. Looking closely at the changes in Minnesota over this 25-year period, you'll see that in 1990, Minnesota was predominantly Zone 3 in the northern half of the state, and Zone 4 in the southern half of the state. By 2015, these zones shifted north substantially, and in fact, zones historically associated with areas like southern Iowa have now arrived in southern Minnesota. Minnesota is now predominantly Zone 4 across the majority of the state, and Zone 5 has now emerged in the far southern part of our state. The other change that we're observing in Minnesota is a change in our precipitation patterns. With warmer temperatures, more evaporation occurs, and warmer air can hold more water vapor than cooler air. This slide you see here shows Minnesota's average annual precipitation. The time frame is the same as the temperature slides shown previously from the past 120 years. The graph on the left highlights the trend from 1895 to 1959, and the graph on the right highlights the trend from 1960 to 2016. For the first 60 years, the trend in precipitation was actually slightly downward, at a loss of about 0.2 of an inch per decade. This downward trend was influenced by the Dust Bowl years of the 1930s. The rate of precipitation in the recent 16 years, however, has increased by nearly 0.5 of an inch per decade. Along with the increase in annual average precipitation, the character of our precipitation is also changing in Minnesota. The overall increase in our average annual precipitation is being driven by heavy rain events. The graphic on this slide points out that there have been 15 historic mega rain events in Minnesota since 1858, which is when weather record keeping began, about 160 years ago. A mega rain event represents a huge amount of rain over a very large geographic area. This is categorized by 6 inches of rainfall that covers more than 1,000 square miles, with the core of the rainfall being at least 8 inches. So to help visualize the size of this large geographic area, 1,000 square miles is the combined size of all of Hennepin, Ramsey, and Washington counties. Over this 160-year period, 7 of these 15 mega rain events have occurred since 2002, just in the last 15 years. And for the first time, we had 2 mega rain events in the same year, one in July 2016 and another in August 2016. One more thing to note about precipitation changes is even though there's more moisture in the atmosphere, that doesn't necessarily mean a consistent rise in rain and snow. The changing character of precipitation in Minnesota brings the potential for both extreme wet and extreme dry spells. Increases in heavy rain events have the potential to cause both increased flooding and drought. Based on localized nature of heavy rain events and their intensity, this can leave some areas of the state drenched and other areas without any precipitation. An example was the year 2012. In that year, 75 of Minnesota's 87 counties were declared disaster areas for drought, which is shown as the brown shaded counties on the map. In that same year, 15 counties were declared disaster areas for flooding. Those are the blue shaded counties. For those 15 counties that were declared disasters for flooding, 8 were also declared disasters for drought within the same year. These are the light blue crosshatched counties. This underscores the intensification of precipitation extremes in both directions. So now that we've covered both the foundations of climate change and air quality in Minnesota, let's move on to take a look at the relationship between them. We'll also review the 3 major air pollutants that are likely to be affected by climate change and are concerned to public health.
We will now be having our next polling question. Air pollution poses a threat to human health. According to the Global Burden of Diseases, Injuries, and Risk Factors study, how many people die prematurely each year as a result of air pollution? 5,000 people, 5.5 billion people, or 50 billion people? You will now have 30 seconds to submit your response. You have about 10 more seconds to submit your response. Thank you. You should now see the poll results on your screen.
Okay. Exposure to ambient air pollution is a major risk factor for disease. The Global Burden of Diseases, Injuries, and Risk Factors study is the largest and most comprehensive effort to date to measure epidemiological levels and trends worldwide. According to their study, more than 5.5 billion people worldwide are dying prematurely every year as a result of air pollution. Climate change is projected to harm human health by increasing exposures to air pollution in many locations. A 2015 report by the Minnesota Pollution Control Agency and the Minnesota Department of Health puts the issue in perspective for our state. The report analyzed air quality data from the MPCA and health data from MDH to estimate effects of air pollution on health outcomes for people living in the 7-county Twin Cities metro area. The report estimates that nearly 2,000 deaths, 400 hospitalizations, and 600 emergency room visits were attributable to air pollutants exposure, including fine particulate and ground-level ozone in the Twin Cities metro area in 2008. This report, titled the Life and Breath Report, used 2008 data, as that was the most recent data available that allowed for linking of air pollution levels and health outcomes. Climate change may affect exposure to air pollutants and allergens in a number of ways. First, changes in the climate may lead to both more windy and more calm days. On the calm days, the still air can be stagnant and pollutants can hang in the air as smog. Second, with higher temperatures, the demand for more air conditioning can lead to an increased pollution because more fossil fuels need to be burned to create more electrical power. And lastly, climate change is lengthening the growing season, which in turn tends to lengthen the allergy season. Climate change is also increasing the allergenicity, or the potency of allergens, and introducing plants with more allergenic pollen. Particulate matter is a major pollutant of concern, as the concentrations are anticipated to be affected by climate change. Particulate matter comes in different sizes, coarse and fine, and from a number of sources. This includes dust and other small particles from construction, mining, and agriculture, fossil fuel combustion by factories, power plants, and diesel and gasoline-powered motor vehicles, and wildfires and wood burning for home heating. Climate change is likely to increase exposures to particulate matter by creating conditions that lead to more frequent and more severe wildfires. Particulate matter from wildfire smoke can often be carried very long distances by the wind, which affects people who live far away from the source. For example, the 2011 Boundary Waters Canoe Area wildfire in the northern part of Minnesota burned nearly 145 square miles. Smoke and ash spread as far as northeast Wisconsin and Traverse City, Michigan. As another example, in 2015, air quality in Minnesota was negatively impacted by smoke plumes that moved into the state from several hundred fires burning in the western Canadian Rockies. Fine particulates reached unhealthy levels, which triggered an air quality health alert for the entire state of Minnesota, including the Twin Cities metro area.
We will now be having our next polling question. Wildfires can be extremely costly. What was the cumulative cost burden of the 2011 Boundary Waters Canoe Area wildfire in northern Minnesota? $2 million, $21 million, or $120 million? You'll now have 30 seconds to reply. You'll have about 10 more seconds to submit your answer. Thank you for answering. The correct answer is $21 million.
Exposure to particulate matter, which can also be referenced as PM, can have serious health impacts. Acute exposure to particulate pollution not only aggravates illness in people with respiratory disease, but it also increases the number of hospitalizations and deaths from cardiovascular and respiratory diseases. Long-term health effects, particularly in the elderly and children, include impaired respiratory function, chronic cough, bronchitis, chest illness, and an increased risk for cardiovascular disease, cancer and respiratory diseases, such as COPD and pneumonia. Particulate matter has also been linked with increased allergic disease and asthma. Populations at risk include those who have an increased exposure to particulate matter, including people who are doing extended or physical activity, like playing sports or working outdoors, especially near high-traffic corridors or stationary sources of air pollution, such as factories or power plants. And some pollutions are more sensitive to particulate air pollution, including those with asthma or other breathing conditions like COPD, those with pre-existing heart disease or high blood pressure, and older adults and children. Moving on to the next air pollutant of concern, the concentrations of ground-level ozone are also anticipated to be affected by climate change. Ozone is a gas that occurs both at ground level and in the Earth's upper atmosphere. Atmospheric ozone protects life on Earth from the sun's harmful ultraviolet rays. However, ground-level ozone is harmful to human health and vegetation. Ground-level ozone is formed by the reaction of volatile organic compounds and nitrogen oxide in the presence of sunlight and heat. Having too much ground-level ozone where we live and breathe can be harmful to our health. Emissions from industrial facilities and electric utilities, motor vehicle exhaust, gasoline vapors, and chemical solvents are just some of the major sources of volatile organic compounds and nitrogen oxide. The health effects of concern from ground-level ozone relate primarily to lung inflammation. Unhealthy ozone levels can aggravate pre-existing lung diseases like asthma, emphysema, and COPD. When the air quality is unhealthy, people with these conditions may experience symptoms like difficulty breathing deeply, shortness of breath, wheezing, coughing, or fatigue. People exposed to higher levels of ground-level ozone are at a greater risk of dying prematurely or being admitted to the hospital for respiratory problems. The higher concentrations of ozone due to climate change may result in tens of thousands of additional ozone-related illnesses and premature deaths per year by mid-century in the United States, assuming no change in air quality policies. Because warm, stagnant air tends to increase the formation of ozone, climate change is likely to increase levels of ground-level ozone in already polluted areas and increase the number of days with poor air quality. The effect is strongest during the summer months, downwind of urban areas where ozone precursors are plentiful. As with particulate matter, there are people who are more likely to be affected when ground-level ozone pollution reaches an unhealthy level. This includes people who have asthma or other breathing conditions like COPD, chronic bronchitis, and emphysema, children and teenagers, and people of all ages who are doing extended or heavy physical activity like playing sports or working outdoors. This also includes some healthy people who are more sensitive to ozone, even though they have none of the risk factors. And there may be a genetic base for this increased sensitivity. While it's true that the majority of days in Minnesota have healthy air quality, those who are sensitive to air pollution know that it only takes one day with unhealthy air to feel an impact. Minnesotans need to be prepared for days qualifying as poor air quality. These are categorized as red or unhealthy on the Air Quality Index. The Air Quality Index, or AQI, is used to represent real-time air quality conditions and communicate current health risks to the public. The Minnesota Pollution Control Agency measures 5 air pollutants hourly, including fine particles and ground-level ozone, and reports the AQI for 17 areas across Minnesota. This map you see on the slide shows the annual count of days in each AQI category for each of those areas in 2014. These counts are based on the daily maximum AQI measured from ground-level ozone and fine particle monitors in each area. The size of the pie chart reflects the number of days with available monitoring data. The number of AQI days in each category varies by region. Typically, areas in the northern half of the state have the highest number of good days. The Twin Cities routinely has the fewest number of good days, and this is due in part to the density of air pollution sources like cars, trucks, homes, and industry in the metropolitan area. You can download the Minnesota Air mobile app or sign up to receive AQI alerts and forecasts from the MPCA by visiting their website at the link shown at the bottom of the slide. Now let's move on to take a look at the third air pollutant of concern in Minnesota, allergens. Allergens, such as pollen and mold, are common air pollutants that are also being impacted by climate changes. An allergy is the body's immune system overreacting to something in the environment that usually causes little or no problems in most people. According to the World Allergy Organization, the prevalence of allergic diseases, such as asthma and rhinitis, has increased to epidemic proportions worldwide. Currently, more than 50 million Americans suffer from allergies each year, and allergy is the 6th leading chronic disease in the U.S. among all ages, collectively costing our healthcare system approximately $18 billion each year. Recently, the World Allergy Organization noted the role of climate change in particular in the dramatic rise of these diseases. Changes in allergens are a concern for public health because allergens can affect people with allergies and asthma. And approximately 10 million Americans have what's called allergic asthma, in which their asthma attacks are triggered by a reaction to pollen or other airborne allergens. Also, allergens can interact with air pollution, which amplifies their individual effects. For example, when ground-level ozone levels are high, it takes much less ragweed pollen to trigger an asthmatic or allergic response. Particulate matter also increases allergic responses by extending how long the allergens stay in the body.
We will now be having our fourth and final polling question. Climate change is impacting allergenic pollen. Which of the following is not a change that we are seeing? A longer pollen season, increased production and potency of pollen, fewer allergy-related doctor visits, or new allergen-producing plant species? You will now have 30 seconds to submit your answer. You'll have a couple more seconds. Thank you for answering. We are noticing all of the changes above except for fewer allergy-related doctor visits. Let's learn why.
Climate change is expected to increase pollen production, lengthen the pollen season, and increase the potency of airborne allergens. The warmer temperatures and changes in precipitation cause some plants to grow faster, bloom earlier, and produce more pollen. Additionally, higher levels of carbon dioxide in the atmosphere act as a fertilizer for plant growth. Both increased temperatures and increased carbon dioxide concentrations are expected to increase plant production of pollen and may also increase fungal growth and spore release. In addition to increased production of pollen, recent studies also suggest that climate-related temperature changes are expected to increase the potency of airborne allergens. These changes increase the concentration of pollen in the air, the length of the allergy season, and the strength of airborne allergens, and associated increases in allergy symptoms. This slide shows an example of the change in length of ragweed pollen season in and around Minnesota between 1995 and 2015. The larger the orange circles, the more days that are now being experienced from increase in the length of pollen season. In Minnesota, we've observed an increase in our ragweed pollen season by 15 days in the southern part of the state to 19 days in the north. In addition to the lengthening of our pollen season, climate change will also allow certain allergen-producing plant species to move into new areas. Windblown dust carrying pollens and molds could expose people to new allergens. As another example, climate changes may favor the growth of trees with more allergenic pollen, like certain oak and hickory species, that could expand at the expense of habitat where much less allergenic pine, spruce, and fir trees currently dominate. These maps show the annual allergenic potential from tree pollen for the current distribution of tree species habitat on your left, and for projected distributions of tree species habitat under a low greenhouse gas emissions climate scenario to your right. As you can see, Minnesota is at a moderate to very high risk for increases in allergenic tree pollen, especially in the central and southeastern portions of our state. The last air pollutant affected by climate change that we'll look at today is mold. Mold growth is enhanced by moisture. Factors that contribute to the prevalence and spread of mold include things like increase in floods and precipitation, increase in temperature and humidity, increase in plant growth and decay, such as leaf litter, and improper installation or management of air conditioning systems. Exposure to mold can cause coughing, wheezing, nasal and throat conditions, and negatively affect people with asthma or weakened immune systems. The final section we'll address today includes general strategies for public health agencies and local governments to help reduce the negative health impacts of climate changes and unhealthy air quality. First, let's look at mitigation. Mitigation policies and strategies are aimed at reducing emissions. They're considered an upstream approach to eliminating climate change impacts on human health because they reduce the risk at the source by reducing release of greenhouse gases. Examples of mitigation strategies to reduce air pollution include making smart choices about how to travel and use energy. Everyone has the right to breathe clean air, and we can all do our part to protect our health from air pollution, while also reducing our contributions to unhealthy air and climate change. For example, as public health professionals, we can work with municipal planning departments to improve or incentivize multimodal transportation modes, such as walking, biking, or public transit to reduce our reliance on cars. Secondly, we can promote telecommuting policies to help reduce fuel consumption, air pollution, and road congestion. We can also encourage the use of renewable energy sources and educate our stakeholders about best practices for burning wood, which can help reduce exposure to harmful wood smoke. Adaptation policies and strategies are more of a downstream approach to reducing health impacts from climate change. They're mainly focused on assisting communities with controlling or reducing their exposures to climate change impacts. There are several examples of adaptation efforts related to climate change and air pollution. First, we can monitor the Air Quality Index, or AQI, and be prepared to act. On unhealthy air quality days, we can have prescripted messaging about protecting health, like encouraging people with breathing conditions to carry their relief or rescue inhaler, and ways to reduce pollution, like postponing the use of gasoline-powered garden equipment. We can also provide guidance and education on how to locate and interpret daily air quality indices and pollen counts. Second, we can improve coordination of health risk communication strategies and integrate climate change into other efforts, such as emergency preparedness. In doing this work, it's important to prioritize outreach and interventions to at-risk groups, which again, this includes people who have asthma or heart disease, children and older adults, and people who are doing extended physical activity outside. Third, we can support data collection and monitoring of air contaminants, along with related health impact measures, such as mortality and morbidity related to air pollution exposures. Finally, we can work with planning and forestry professionals to prioritize climate-resilient, low-allergenic plants for residential, business, city, and county landscaping. There are many species of trees, shrubs, and plants to choose from, but in general, we can encourage species that are pollinated by birds and insects, such as apple trees or dogwood shrubs, and utilize species that are pollinated by wind, such as many of the ornamental grasses, either sparingly or in strategic locations. The Minnesota Public Health Data Access Portal, an online data resource from the MDH Environmental Public Health Tracking Program, is an online resource designed to better equip Minnesota's communities and public health professionals to explore the relationships between environmental exposures, risk factors, and health effects. The portal features information like interactive charts and figures, maps, custom tables, and county profiles across a range of environmental health indicators, including air quality and other climate change and health topic areas. This is a resource to keep in mind as you work to understand air quality and health impacts in your community. You can access the portal by visiting the link shown at the bottom of the slide or by visiting the MDH website and searching for Data Access Portal. We can also play an important role in mitigating and adapting to climate change on an individual level. The next few slides list actions each of us can take to make a difference. Energy production is one of the big three contributors to our changing climate because burning oil, coal, and natural gas to generate electric power puts a lot of greenhouse gas emissions into the air. As individuals, we can each reduce the amount of greenhouse gas emissions we cause in a number of ways, like using less energy to heat or cool homes, using energy-efficient appliances and light bulbs, and reducing, reusing, and recycling what we buy and use on a daily basis. However, what's really going to make a difference is having all of us rely more on renewable energy sources, like solar, wind, and biofuels, and less on fossil fuel energy sources, like oil, coal, and natural gas. As individuals, we can support public and private sector policy changes that can lead to more renewable energy production. A policy example is Minnesota's Next Generation Energy Act of 2007, which has achievable greenhouse gas emissions reduction targets for the year 2025 and beyond. Transportation is the second big contributor to our changing climate because burning fuel to power vehicles emits a lot of greenhouse gas emissions. As individuals, we can each reduce the amount of greenhouse gas emissions we cause by using transportation choices that burn less gasoline or diesel fuel, like walking, biking, using public transit, carpooling, and telecommuting when possible. Another option would be to drive an electric vehicle powered by wind or solar energy. However, what's really going to make a difference is if we all have more transportation options that either burn less or don't use any gasoline or diesel fuel. As individuals, we can support public and private sector policies, like increasing gas and diesel mileage standards, incentivizing the production and purchase of electric vehicles, building more transit options where sufficient population density exists, and having policies that support telecommuting. Agriculture is the third big contributor to greenhouse gas emissions because it takes a lot of energy to produce, process, and transport food. As individuals, we can each reduce the amount of greenhouse gas emissions we cause by buying more locally grown foods, eating fewer processed foods and less meat, and even growing some of our own food. However, what's really going to make a difference is if we all have access to foods that are produced, processed, and transported using less energy. As individuals, we can support public and private sector policies that incentivize foods produced with fewer chemicals, foods that are less processed and closer to their natural state, and foods that are transported shorter distances. So in summary, Minnesota's climate is changing. We're seeing an increase in temperature and changes in our levels of precipitation. These changes will likely increase levels of particulate matter, formation of ground-level ozone, pollen, and mold. It's important to remember that certain populations are at a greater risk from exposure to air pollutants and allergens. These include those with existing respiratory and cardiovascular conditions, the elderly, and children. And lastly, it's important to remember that everyone has the right to breathe clean air, and we can all do our part to protect our health from air pollution and reduce our contributions to unhealthy air and climate change. Public health awareness, education, and coordinated mitigation and adaptation planning with other agencies can help reduce the health impacts. So with that, we're at the end of our presentation today. Thank you everyone for attending. We hope you found this useful in supporting your efforts to address climate change and health in your communities. And I believe now we have time for a few questions.